Just out of curiosity, where do you think innovation is going to come from? I mean, this is the age-old argument. We have health systems have innovation arms. They're doing their part in the innovation world. Big tech is doing innovation. We have health tech startups and just all the money flowing into healthcare startups and those kind of things. Where do you envision that we are going to see a significant amount of innovation come from?
Well, I think all of the above, and I would, rather than label it health systems versus anything else, it's creative people. I know a couple of CIOs of small or to mid-sized medical groups that are this one-person font of knowledge, and in a small enough environment, they've been able to develop really interesting, effective programs, analytics types of programs, remote patient monitoring programs, because they were creative and clever, and they were able to convince their bosses that it was a good idea to try. So I would say it's more from a creative, forward-thinking organization, whether it be an insurance company or a health system or a large medical practice. It's more the attitude and the risk aversion state of mind, to me, that will bring the innovation. There's always going to be the vendor community. We know that. The doc that's not satisfied practicing medicine because he thinks that his system, his organization doesn't give him or her enough support, and they go out and invent something. They will always be there. And it's a question of matching all of the parties together and finding what works, finding the organization that's willing to take the risk on them.
Yeah.
And as you know, when you look at the health systems, there's some really interesting things happening within a number of health systems.